Hello and welcome back to All Therapists Are Jerks. This is Ulland.
And this is Jo. Today we're going to be talking to you about, or talking a little bit with one another, I guess, and whoever might be listening. We're going to talk about mindfulness. In future podcasts, we'll be talking about how mindfulness specifically, or what specific skills of mindfulness we teach in DBT. But for the purposes of this podcast, we're going to talk a little bit more about the role of mindfulness, the function of mindfulness, what mindfulness is exactly. So mindfulness is the core of DBT. So DBT is based on acceptance and change strategies, and you can't really change anything if you're not aware of it. So if you're not mindful, if you're not aware, you can't actually move into change.
Right.
I think something that is a little bit challenging for a lot of our residents, or probably outpatient patients, or even ourselves in general, is increasing awareness. I think there's a fear that as we increase awareness, we're actually going to increase suffering because we do so much avoiding. Mm-hmm. And so I know that we get hit with a lot of resistance sometimes. We're like, well, why would I want to be more aware of what is actually going on? So DBT is the core. The core is mindfulness, and we teach specific skills such as wise mind, what and how. Actually, it's what and how first, and then you teach wise mind, which we'll have podcasts about in the future.
Right.
So what is mindfulness exactly? That's a good question.
We talked about earlier, I think, is really having more awareness, like right now in the current moment, about what's going on. We all have automatic behaviors that we do, and we can be trained to do behaviors because we're animals, basically. So with or without mindfulness, we're going to be engaged in these automatic behaviors. So an idea might be like all of us, if we're people who drive or even ride bicycles, like you show up at where you're supposed to be, but then you realize, like, if you really think about it, you didn't really make a conscious decision along the way. So I often like the idea of the blinker. Like, I know I often use it, but if I'm not having a mindful morning, I can show up in the parking lot and realize, like, oh, I totally didn't use my blinker. Like I used it, but I didn't actually decide to use it. Yeah. It was automatic. So I think it's helpful if you're going to change behavior, you just have to be more aware of behavior, to make a different decision.
Right. And I think this really helps people become less reactive and more responsive. So as we increase our awareness and we're not on autopilot quite as much, then we actually have increased choice. So I think that's why it's the main core of DBT in general, because we want to be able to increase choice instead of engaging in our ineffective behaviors, whether it is self-injury or suicidal ideation or substance use or binge watching Netflix or working too much. Any of our general automatic or autopilot behaviors that we do, they're going to be difficult to change if we're not actually aware of what prompts them to be happening in the first place. So it really is bringing yourself back to the present moment as much as possible, and then opening up our choices to do something different.
Right. Another feature of mindfulness is that we're being aware, but without judging or rejecting the current moment. So you're not like fighting with reality, and then also not judging the reality or the experience that you're having by kind of putting your own spin on it, your own story with it. So you also have to let go of evaluations of what you're observing, and you're also being forced to face the current moment and not avoid it.
Well, which is huge in our previous podcast that we covered with radical acceptance, or the reality acceptance skills, and reducing suffering, is that awareness that we have evaluations. And it's not even so much not having evaluations, not having judgments. It's being aware of the judgments and what the judgments are telling us, which helps us be more factual in the present moment rather than hanging on to some of those stories and narratives. The shoulds, that shouldn't be like this, they shouldn't do that, I should have done this instead, because that's not reality acceptance. So mindfulness is a core component for pretty much everything we do. You can't make effective changes if you're not even aware of what's wrong. We talked about that in the theory of stuckedness too, if you remember. Mm-hmm. Like, if we don't have awareness of what the problem is, we know that there's a problem, but we don't have any awareness of what drives a problem or what is the root of that problem, we can't actually change it.
Right. Or you'll think it's some other problem that you'll try to work to problem solve, but actually it's not helpful because it's not really the actual problem that's going on.
Exactly. And then the other thing that's really important with mindfulness is purposely paying attention to the present moment while letting go of the past and not looking into the future. And that is so hard.
Right.
Because our past informs how we are in the current moment. And then our fears of the future or our hopes for the future are all things that help drive forward momentum. So it can be really easy to attach to catastrophizing thoughts. Like, oh my God, if this happens, then that's going to happen, and then I'm going to be homeless under a bridge.
Which is anxiety.
Right, exactly. Or I'm worthless, nobody loves me. Maybe I have a history of really disruptive relationships. And at the end, my narrative ends up being like, it's always like this. It's never going to get better. And we'll ruminate and chew over and over again the past, and we can't really move forward. So being able to be in this present moment, I think it's actually really huge in family therapy, to be honest with you. Mm-hmm. So as people are recovering and as they're increasing their awareness, oftentimes there's so much fear of relapse into old behaviors that we judge one another or judge ourselves based on past behaviors. Well, I can't do this. I've tried to do this before. I haven't been able to do it, so I can't do it. And then that becomes your reality.
Right.
Whereas if we're in the present moment, like, well, actually right now in this moment, I am doing it. And I'm not worried about if I'm going to be able to do it in 5 minutes from now or that I couldn't do it yesterday. Right now in this moment, I am doing it.
Mm-hmm. Yeah, I think it's very helpful because catastrophizing or the what if, that's an anxious process. The looking back into the past with like negative evaluation of yourself or your worth or those kinds of things, that's shame. So shame is often backwards looking and anxiety is often forward looking. And so if you stay in the current moment or get good at it as a skill, you're less likely to fall into those patterns of thought and behaviors, which will, ultimately help reduce your suffering. So, and this is what they find, people with anxiety disorders, one of the best things you can really do is actually engage in a lot of mindfulness practice.
Right, exactly. And I think mindfulness also helps. I know that when we're teaching families mindfulness and we're also teaching the residents mindfulness, that I think especially families have a really difficult time with that, letting go of the past piece of it because the past was so scary that they're always on high alert for, relapses into past behaviors, that they're not accurately assessing their loved one in the moment and not able to see the changes that are there, which then could actually cause relapses in behaviors because you're not trusting them. And if they believe that you believe they're not going to change or haven't changed, there's an increased likelihood of them being relapsing into those behaviors.
Right. That's very true.
So I think the next part of what we want to talk about is the role of mindfulness in DBT. So the definition, obviously, we've talked about already, but is living with awareness in the here and now without judgment or attaching to the judgment or rejecting the moment or attachment to the moment. So being present as much as we can, one mindfully. And mindfulness is the core skill set of DBT, so it's taught first in outpatient DBT. So if you were in an outpatient clinic, when you would enter skills group would be during a DBT module, which is typically 2 weeks long. And then it's taught between every single other module. So for instance, you might learn mindfulness and then move into a distress tolerance skill, and then the group would open up again, allow new members to come in, learn mindfulness, and then go into emotion regulation. Group opens up again, we do mindfulness again, and then interpersonal effectiveness. So mindfulness is revisited, and it's actually reviewed and highlighted throughout all of treatment. So even though you may feel as though you've mastered, what and how skills or wise mind, you can't actually do any of the other skills without mindfulness.
Right.
It can't actually happen.
And a lot of the skills, I think, connect throughout DBT, like the needing one skill to use another skill to use another skill. So it takes a while to learn how to do it. And the ones that seem to be most connected to everything is really mindfulness. And so there are three larger goals, I guess, for mindfulness and what it can be helpful with. And one is to actually reduce suffering. So if you look into literature and research, which there's been a lot of research done on mindfulness, we find that practicing mindfulness increases our ability to regulate emotions. You also can see on functional MRIs and PET scanners that you see an increase in activity in brain regions related to positive emotion. You can see it improve immune responses to infection or to immune challenges. Often people report a larger sense of wellness, also more of a feeling of choice in life. People often, there's been some evidence even for something like ADHD, which is attention deficit hyperactivity disorder. And, the idea would be that would be a chemical imbalance, but actually for some people, if they're practicing mindfulness a lot, they actually find themselves more able to pay attention and less distracted overall. And that even tends to hold true even for some people with ADHD.
Okay, food for thought or tidbit of information or something like that. University of Wisconsin at Madison is like the hub for mindfulness research. They actually have Buddhist and Tibetan monks come meditate while they're in a MRI. and like look at the regions of the brain that fire. So it's really cool that University of Wisconsin's on it.
What I thought was interesting in one of the books, they talked about looking at a test where they actually have something as loud as a gunshot go off in a pair of headphones, and then they're measuring people's physiological response. And what they found with monks who are very, very skillful is that actually they don't have much of a startle response at all. Whereas some people have panic attacks, or they just jolt in their chair because it's like having a gunshot go off by your ear. They talked to one of the monks about this. What is the experience like when you heard that sound? And he had said that, well, it actually sounded like I heard a loud sound in the valley over. So like in her mind, it was like, yes, there's a punctuated type sound, but it was echoing through a valley that was farther away from them. So that idea of just like that level of mindfulness actually gives you so much space and distance sometimes from immediate responses or immediate reactions.
Exactly. So research has increased all of the things we just talked about, but it's also been research has also shown that mindfulness decreases distraction, rumination, which we've kind of already talked about. I'm more able to focus on individual tasks, not stuck in my head very much. It can also decrease depression, anxiety, anger. There's a ton of research on mindfulness for pain. So being able to pay attention to pain, describing objectively what the quality of the pain is. Is it dull? Is it sharp? Where's the exact location of it? The attention to it oftentimes actually reduces the intensity of it. Or the other thing that can happen sometimes is when you focus on an area of non-pain. So it's like the non-toothache, like nobody ever really considers what it's like to not have a toothache until you have a toothache.
Right.
Or the asymmetry. So, when I broke my wrist, it was really easy to focus on the pain in my wrist, but I would practice some mindfulness where I'd pay attention to the non-pain in the left wrist and actually reduce the intensity of the pain. Really awesome. Okay, I got really excited because I remembered this example. When I broke my wrist, remember how it was like I was kind of limp and
it wasn't moving right.
It wasn't moving. I couldn't actually use my fingers very well. When I had to go fill out all the paperwork, it was my dominant hand, and I don't write with my left hand at all. And I had to fill out all of my paperwork with my left hand. And what I noticed as I was concentrating so hard, I think I literally had my tongue sticking out of my mouth, and I was like kind of looking like a little kid, like trying to draw something. In the handwriting, of course, I had tons of judgment. I noticed the judgments of my handwriting. I will have to tell you that. But what I did notice is while I was filling out my paperwork, I was not as aware of the pain in my right wrist. As soon as I recognized that I was not experiencing pain in my right wrist, I all of a sudden started experiencing pain in my right wrist.
Yeah.
Again, it was really weird. But I think it was really helpful because my mind was so focused on being able to write legibly with my left hand that I completely lost sight of the pain in my right wrist. So that just shows how powerful mindfulness can be. So if we're mindfully focused on one thing, we can draw that attention away. So there's a lot of research with pain. And of course, psychological distress, that will decrease as well. And impulsivity. I know that we've experienced that a lot. I know I had a resident not too long ago that came in and she was like, I'm just so impulsive. I think I'm bipolar. And I was like, no, you're just super avoidant, man.
Right.
And we started practicing mindfulness with her, and it was really hard for her. And her impulsivity started to decrease. By the time she graduated, she was like, oh, I guess maybe I'm not bipolar. And I was like, yeah, no, you were just really, really, really avoidant. You couldn't be in your body for more than 30 seconds without wanting to jump out of it.
As a psychiatrist, so like how people describe things with words, right? So people say, well, I'm irritable, but I don't really know when someone says irritable, what does it really mean? How do they describe that in a way that's useful to me? And then also people say, oh, I was manic-y or I was manic. And even more now after working with residents that we work with is that you recognize that like manic can be described so many different ways. There's so many processes that could be misattributed to like a hypomanic episode. I've seen so many residents where their avoidance pattern is this impulsive, almost slightly euphoric type of energy, and we often can see that on the unit we work on, and it's actually just, it's incongruence. It's not real. But, that's a kind of mood lability that you might see with emotional reactivity that sometimes it looks like they're experiencing joy. It's actually not. It's actually anxiety and impulsivity because they're so anxious to actually feel a negative emotion that they're kind of on the run from it, like misinterpret that to hypomania or joy or excitement, but it's just pure anxiety.
Exactly. And I remember also when she first started, she would often say, I can't control it. It's impulsivity. I can't control it.
Right.
And I was like, well, you can. So you're having the thought that you can't control it. So we went back to mindfulness of current thoughts in that moment, right? We labeled it as a thought. You're having the thought that you can't control it. And right now it maybe feels like you can't. And with time, you will be able to. And so her quote unquote impulsivity decreased significantly in the short time she was with us just by practicing mindfulness, even though practicing mindfulness was a struggle for her. Which I think then brings me, did you have something you wanted to say about that?
Well, to me, like how remarkable it is to watch most residents become calmer in their body over time. Pretty much all of them do. Like none of them have like increased like energy and anxiety in their body at the end of treatment. Most of them are vastly calmer in their body at the end of treatment, or definitely better and just settled is the best way to put it.
I have like 6 thoughts at once. This is awesome. That was mindful to know I was having 6 thoughts at once. When you said that, it reminded me of a lot of the work that we do, which is helping them build a self-identity that is based more objectively rather than in the story and the narrative that they tell themselves.
Right.
And as they practice mindfulness, like by the end, you actually feel like you're sitting with them in a room, not some artifact of them. There's sometimes we sit with people when they first come in and it's like, 50,000 things hitting you at once and there's all this incongruence. And by the time they leave, just how grounded they are in themselves, you actually feel like you're sitting with
right.
what is the makings of this person. And that takes a lot of mindfulness. The other thing that I kind of wanted to say, and I don't think we've addressed this yet, is that meditation is a mindfulness practice, but meditation does not equal mindfulness. I think for a lot of our residents who come in with really busy minds and really busy bodies, they're like, I can't sit through a meditation. And so we have to kind of describe to them that meditation is a way of being mindful. It's a way of training your brain. It's a way of getting to know your brain or your body. It is a way of increasing awareness, but meditation in and of itself is not mindfulness. It's a mindfulness practice.
Right.
And for some of those, like if your brain is really busy or if you have a lot of activity in your body, you can modify your mindfulness practices to fit where you're at. And of course, keep coming back to meditation as a form of it.
Right. And I think it's nice because there are mindfulness practices where you're actually walking mindfulness can be one, but there are some mindfulness practices where you're actually quite active while doing them, which is pretty much kind of the antithetical to the idea that you're sitting in a room floating on a pile of air, and saying, So I think that's helpful to know that there are more ways that you can be mindful. And you can be mindful while doing a task also.
So many residents, and even people that I talk to, sometimes I'll teach mindfulness in inner city schools in Milwaukee, or I'll teach mindfulness even at my church or with my kids. And so many people have this concept that mindfulness is supposed to have like a goal. A lot of our residents, after we maybe practice some mindfulness together, will say, what were your observations? And they're like, it didn't work. I was like,
right.
well, there wasn't a goal, was there? Was there a goal to it? The goal is to increase awareness of what is. So a lot of times, it's a lot of restructuring with residents when they say, well, it didn't work. Well, what exactly do you mean? Were you more aware of body sensations? Like, well, I don't feel more relaxed. Well, that's good. You're aware that you don't feel more relaxed.
Right. I've done mindfulness where I'm just like more worked up afterwards.
Yeah.
Often calmer in my body, but sometimes I'm like, man, I had the same thought, that didn't work, but that was my goal of being calmer. But maybe I had some other level of awareness about something that I actually found upsetting or something was difficult to think about or to do.
Right. And that's when I say to them, like, well, it did work. And they look at me like, what?
You noticed?
I'm like, yeah, you noticed that you're more agitated. So that means it worked. You were aware of something.
Yeah, increased awareness.
You're aware of what is, right?
And unfortunately, it's that you are aware that you're uncomfortable, basically.
Exactly.
So another goal of mindfulness is really to increase awareness in your mind. One thing it's really beneficial for is focusing attention, keeping a focused attention on something.
Or intentionally being able to detach yourself from your thoughts, your emotions, your body sensations. So many times, I am sad. I am angry. No, you're having the experience of sadness. You're having the experience of anger or, believing our thoughts to be facts. When we are able to either focus or diffuse our attention, we can really reduce our suffering. So that's kind of like with my my wrist,
Right.
like focused attention on my non-dominant hand diffuse the attention to my broken wrist.
I found for me that's very helpful is the distance with mindfulness, which I think I've appreciated more. I mean, I appreciate that I'm far more aware of what's going on in my body than I've ever been. Like I got really good at not listening to my body. But I think also just that I have this increased distance from my own thinking. So I like to think a lot. I'm thinking all the time. But then I'm far more able now to kind of like watch my thinking as an observer.
Mm-hmm.
Like, I'm experiencing the way that I think, or I might start thinking about the way that I think about something rather than just thinking about something.
Oh, metacognitions?
Metacognitions. So like that, like the Russian dolls. I mean, you can think about the way you think about the way you think, and it gets very confusing. But at some level, that's helpful to be able to step outside yourself kind of and be able to do this. So then you're not as likely to hijack because you can say, well, I'm having the experience of sadness, or I'm having the thought that I'm lonely or that I'm alone. And then, but you're also, because you're saying I'm having an experience, well, experiences are temporary.
Right.
There's less threat in that. But it's also like, it's not your total being, at that moment, like your total being of existence is this thing. No, it's not. I'm having an experience. And life is full of these different kinds of experiences. Some are positive and some are negative.
I tell the girls a lot, or when I'm teaching at inner city schools and stuff, I do talk a lot about increasing the awareness of how your mind works. So every mind is different. And I think, I think a lot, and I say like a lot. I've learned that in this podcast. I say
It's
and
been
like.
good feedback.
Yes. Thank you for all of you who have offered feedback that I say and like too much, and that I go up on the end of my sentences. I'm working on it. And was aware of shame responses in my body when I received said feedback. And I'm fallible, and I'm going to keep on doing it. Anyway, so I always tell people that it's kind of like a gentle exploration of like, how does my mind work? Rather than judging the mind or getting caught up in believing that the mind is true, like how does my mind work? So I know for me in certain circumstances, I will have a narrative of like fear of rejection or fear of abandonment. That's a big one for me based on my lived experience. And I can recognize when I'm slipping into those thoughts, and I'm able to tell myself, oh yeah, this is your story about your fear of abandonment, factually in the moment, what's actually happening. So like I'm stringing that together with other skills at that point, but I have to be aware that I'm having this narrative that I tell myself frequently when things are stressful. And so it's just learning like how your mind works and kind of making friends with it rather than trying to fight it,
Right.
or listen to it constantly. That's like
Right.
the monkey mind video I like to watch.
Right. And also having increased awareness then allows you opportunity to react wisely or respond wisely rather than reacting in the moment. So just that, again, that further distance, that once you're aware of it and the way you're thinking about his experience, you then have the choice, well, do I want to change this or do something about this? Or am I okay with it being here and it will pass in due time?
Right. And I think that's a big piece of radical acceptance too. It's like, I am feeling this right now. This is what I am feeling right now, rather than trying to jump into change, especially when our emotions are intense. And that can help us move into being able to use our distress tolerance skills to recognize that I am dysregulated right now. So you can make a choice that's in line with the values or in line with recovery rather than the same repetitive behaviors.
Right. So a third goal of mindfulness is to be able to experience reality as it is. And Joe's made comments before. It's a more objective. It's finding objectively what's going on around rather than the story that you might tell or the assumptions that you might bring in or the judgments that you bring in.
So when you're experiencing reality as it is, you're experiencing connection or lack of connection, loss of connection, removing the judgments, which is really difficult. So first of all, you have to recognize that you're having judgments and then recognize what are those judgments telling you. And then acknowledging the inherent significance of the moment. I think that that's a really important piece because really life is a stringing together of moments.
Right.
And some of them have more significance than others, especially when we're dealing with loss or promotions or love or, so we have what we call like benchmarks or specific instances in life where you can remember intense emotions, but really every moment has significance, because it's the only moment we actually have.
Yeah.
And the other part of experiencing reality as it is actually being able to be present in your own life in the current moment.
Right.
So again, not living in the past, not so focused on the future. And I think all parents maybe specifically moms, because I was a stay-at-home mom for quite a while. And I always remember thinking like, oh, this is just a phase. We're going to get to the next, we're going to get through this phase. We're going to get through this phase. We're going to get through this phase. And then I think with that energy, you miss a lot of joy. You miss a lot of positives, so like the terrible twos.
Mm-hmm.
I think it used to be the terrible threes, right? Or I don't know. But like the terrible twos, I really think they should be the terrible threes, I think.
I think everybody says that, but just doesn't, have that
Doesn't
alliteration.
work. Yeah. But you're like, oh, they're going through their sassy phase. We're going to get through this. Or, oh, God, I can't wait till my kid is sleeping through the night because I'm so exhausted. But there was also really peaceful moments in that, too, that we don't really focus on. And if we're constantly like looking ahead to the next phase, what phase is next? What phase is next? We've really missed out a lot on what exists.
Well, I think, too, with mindfulness, to be honest, if you start looking into, so you talk about the sassiness, right? So in that moment, like, enjoy the sassiness. Part of the idea of an infant or a toddler starting to say no is amazing, because actually it's like, hey, maybe I'm a little person. Like, part of it, they're psychotic. Like, babies believe,
psycho babies.
They do. Like, they, on some cognitive level, they believe, an emotional level, like the breast is theirs. Like, they don't really understand that that's not part of them. And so at some point they have to learn that, oh no, it's this other body with me, like my mom's body. But then also they start to learn, like, wait a minute, I could make decisions. Like, I don't have to agree. I can fight this. I can make a decision. And then this is where they're developing the sense of I, right? Like, it's a very important thing. But you can look at it as like, oh, it's just so annoying, the terrible threes. Or be also if you're in that moment, be like, oh, that's their willpower. That's their will. Like, that's a little person's will. And if you snuff it, you can have a kid that has a very hard time sticking up for themselves or asking for things or being assertive if you're harsh on them being willful at times. And so sometimes the willful has to be normal.
And shaped.
Yes.
Yeah. And so, I think being present in your own moment or in your own life, moment by moment, it actually increases gratitude. And I believe that it improves positive connection, which then leads to being present with others. Right. If I'm all up in my head about what I've got to do at work, or if I get home from work and I'm ruminating over maybe a difficult session, what I could have done differently, and then I walk in the door and my kids are like, Mom, I'm not actually present with them because I'm in my head about work. So to be able to be present in the moment, see the others in my life as gifts, in good and bad, even when they're going through difficult times. My youngest, she gives me a run for my money sometimes, and she's a really autonomous, incredible little human being. And some days I'm just kind of pooped.
Right.
But if I don't take care of myself and recognize that in myself, and I'm ruminating about how I'd rather have things be or what things should be like, then I'm not really present with her in the moment, which is a loss of connection.
I agree with that too. Like, just as a clinician, technology is super distracting, and I'm someone who needs time to think about things. Not because I think slowly, but because I think so much, and I don't like that to be distracted. And so I think, like, meeting with patients, it's difficult because I always hated the pager. And even with cell phones, like, people can...
You're dating yourself. You're like so old.
Oh, so old. Hey, I saw a pager today. Today I saw a pager, and I almost wanted to ask. I believe she was maybe a nurse, but I was like, oh, there's a pager. That's interesting. Like, do you ever use it? It's pretty funny. But I think, like, even texting, like, there's this expectation as a psychiatrist that you get right back to whoever's texting you right away. And I find that obnoxious. Because to me, when I'm meeting with residents, like, I'm there with them in that moment. And I do recognize there are times when I am distracted or I'm not quite present, and I know I miss stuff. There's so much I think that in session that occurs to me. I'm like, you know what, this is so subtle. Like, this would be so easy to miss if I went to, type in my note real quick, or, look in the computer for some information, or be checking my phone real quick because I just got texted. Like, even sometimes the sound of my phone buzzing because I have it on silent can distract me enough where I feel like I lost a moment there, or I feel emotionally like I've lost the connection because that phone distracted both of us.
That actually brings up another good point. I think when you go into a session and you have an agenda,
right,
and you're thinking about your agenda and you know what you've got to get to, you're actually missing out on connection with your resident or even like your loved ones. So like if you're not a clinician and you're trying to improve the quality of connection with people, if you're in your head thinking about what are you going to make for dinner and they're trying to connect with you, you're not actually present to them in that moment.
Well, I kind of look at it as if you think you're going somewhere from the start, that's a problem.
Right.
I think that's that idea. So if I have to, I might have an agenda, I might need to talk about something with someone, and when I meet with them, the first thing I'm really going to do is I'm really going to connect. how's your day? What's going on? How have things been? Like, I really want to have an emotional connection to the individual. And eventually I'll get to maybe, or forget, but probably get to what I need to address at some point. But the primary goal, number one, is to connect. And that's not like, doesn't feel like it's going anywhere. It's just we're connecting. It's being in the moment with someone else who's also in the moment, and kind of protecting that moment long enough. I think that's important.
Exactly.
And then, so that mindfulness becomes a practice. So the practice is that you, with repeated effort, is bringing your mind back to awareness without judging it. So your mind is going to wander. Even Zen masters' minds wander, or they get distracted, or they get internally distracted. You recognize that without tension or control. You just kind of recognize, oh, I'm wandering, and here's what I've been doing, or here's what I'm doing now. And to bring it back over and over again. It can feel like herding cats. And if it feels like that, then actually mindfulness is probably going to be quite helpful to you.
Mm-hmm.
And as we kind of commented earlier, that mindfulness can be done with activities. You could be washing the dishes, but doing it mindfully. You could just focus on the physical sensations of washing dishes. You could focus on the sound of washing dishes while you're doing it, but you're being present in that moment in a sensory way. It's really pretty important and can be done a lot, whereas people think they have to have a chunk of time. Like, here's this half hour where I do this mindfulness practice, or guided imagery. It's a form of mindfulness, but you can choose to be mindful in many different ways.
One of the challenges I often give when I'm teaching mindfulness is to have individuals be mindful of brushing their teeth, because it's 2 minutes.
Mm-hmm.
Now, I'm a cheater, and I have a toothbrush that's electronic or ultrasonic or whatever, and it like pauses every 30 seconds, so I know when to shift sides of my mouth. And I oftentimes I'll try to mindfully brush my teeth, and I'll recognize that I've completely been lost in thought, and because it'll pause and tell me it's time to move. I'm like, oh, I was lost in thought. Okay, come back. And that's just a small way of letting people know that they can increase their awareness. Like, what is the taste of the toothpaste? What does the toothbrush feel like on the gums? Are you spending more time on one side than the other? Just really recognizing, the moisture that builds up in your mouth, or just to have to spit out the toothpaste. Even in 2 minutes, just paying attention to brushing your teeth can really improve the quality of your life. So it doesn't have to be these long, practices like you said. They can be little moments here and there. Driving's a great time to practice mindfulness. Mm-hmm. Just noticing that your shoulders are up to your ears, and you might be having judgmental thoughts about the cars and drivers around you, and okay, relax, let those go, and then whoop, it's going to come right back, and then relax and let it go. I think it can be, extraordinarily helpful.
So this has been an episode of All Therapists Are Jerks with Ulland
and Jo.
Thank you for listening.